Hey, everybody. This is Eric Arzubi, Frontier Psychiatry, along with the crew from Mountain Pacific for 3D Echo. Wanted to, just wanted for everybody, look, we don't have a ton of people here today, so maybe everybody can just go around and say hello because it's a very intimate situation. No, Amber, you want to go ahead?
Sure. Amber Rogers with Mountain Pacific Quality Health.
Mary Argonis, Mountain Pacific.
Cool. Azriel?
Hey, this is Azriel from Big Island Pediatrician.
Thank you. Heather?
I'm Heather Pratt, and I work at Logan Health Shelby in Shelby, Montana.
Thanks, Heather. Lori?
Hi, I'm Lori Henning with the Healthcare Association of Hawaii.
Thank you. And I'm just going to call you Ku'u because I'm not going to get the rest. I tried once before. Is that okay? Not getting answers. Maybe I'm just supposed to pronounce the whole thing. Ku'ulei kupono ke aloha. There. Now you have to check in. No?
No.
That was a good effort, though. What do you think, Mary? And then Shayna. I can pronounce Shayna. Shayna, say hello. Come on, man.
Sorry, I was finding my mute button. Shayna, I'm also with Frontier Psychiatry.
Thanks, Shayna.
Yeah.
Cool. So today I was supposed to talk about autism, but I didn't. I messed up and prepared to talk on ACEs, which is next week. So I'll be I'll be focused on autism next week. Again, so kind of big picture on ACEs, and then we'll jump into the presentation. The study itself. So the study itself was done in the late 90s, and again, this was one of the first really robust studies to show us the link between what happens in childhood and health outcomes in adulthood. And just as a quick reminder, the way the study was structured was, the roots and the origins of this study were from Kaiser Permanente. I believe it was in an obesity clinic where folks were treating obesity were seeing a pattern in terms of experiences in childhood that were common across a lot of folks who were struggling with obesity. And so they came up with an idea to see what are the links to health outcomes from childhood adverse experiences. And so again, late 1990s, Kaiser Permanente led this study and basically looked at around 20,000 people from California, and really mapped the adult. So these were 19,000, almost 20,000 adults. They looked at what does their mental health look like, what does their physical health look like, and what did their childhood look like. And they were structured about the way they looked at their childhood. And they said, all right, we're gonna come up with kind of almost like a risk score, right? 0 to 10. And the 0 to 10, they took 10 types of adverse childhood experiences, and there are 3 kind of categories. And you'll see that here in the presentation. But again, there are 3 forms of abuse, 2 forms of neglect, and 5 forms of family dysfunction. And then when they mapped those 10 items against actual physical and mental health in adulthood, they saw some remarkable links. And again, what's interesting about the ACEs is just because you have one of these adverse childhood experiences doesn't automatically mean you're gonna be sick forever. It's a risk factor, right? So it just elevates the risk of certain things happening in adulthood. And again, we'll look at those in a second. But again, I just want to give you guys some context of where kind of the study came from. The other thing I would argue, and it helped me advocate for for how important childhood experiences are in terms of future health. It's a little bit easier to have these conversations when you're talking about having a discussion like this in a mental health clinic, or among people who kind of are well versed in talking about sort of mental health and child development in general. But when you're talking to a hospital system about the importance of understanding the psychosocial history of someone, even when they're children, it's hard for them just to kind of understand that link between what happened in childhood and what's going on now and the impact of these adverse childhood experiences. So this actually helped me, especially when I was working at an organization called Billings Clinic, it's a big healthcare system here in Montana, explaining to folks who are kind of pure medical professionals the link between these things that happen to children in when they're young and the physical and mental health outcomes. And so I would say that's one of the most effective things I was able to use this study for, is in terms of advocacy and education for folks who are not living with this every single day or understanding this world every single day. The other thing I would say is, by understanding the impact of ACEs on future physical and mental health, it also helped quantify for people the impact of these psychosocial stressors. In other words, before, like in medicine, when you go to medical school and then you go to let's focus just on medical school. And before you specialize either in, psychiatry and surgery or family medicine, pediatrics, but when you go to medical school, they teach you kind of how to do a comprehensive sort of patient evaluation and interview. And one of them, so what do they ask about? Well, what's your chief complaint? What's a history of present illness? And then they ask a couple of other items with regards to history. So, for example, what's your medical history? What's your, in our case, I always ask about psychiatric history. What about past substance use? Then social history, and then family history, right? So genetics. But, we're not always taught what to do with those histories, especially the social history, right? So before ACEs came along, or before I was made aware of ACEs, I'd get the social history, but I'm like, okay, that's interesting, but what does that mean? Well, ACEs, at least for me, and I think this is the way I kind of try to teach it also, is ACEs actually now helps me quantify some of the risk, right? So before, when you're taught social history and you're asked about somebody's childhood or kind of their living situation, you're like, okay, that's interesting, but I don't know how it plays into kind of health risk factors. Well, now ACEs kind of gives you you can attach some risk, some probability to kind of bad things happening based on the number of ACEs that someone has. So big picture is when we looked at these 20,000 people, we know that 2/3 of the population, and this has been shown over and over and over again, we know that 2/3 of the population has at least one adverse childhood experience. We know that 1 in 8 have 4 or more. That's 1 in 8 have 4 or more. And that 4 or more adverse childhood experiences is actually a pretty important tipping point when it goes from kind of, low risk to kind of starts flipping over into medium and high risk for developing mental health and physical health problems. So again, just keep that in mind as context. I'll go over the slides and then we'll have some more conversations about this. I'm just going to jump in here. Let me see. Oh wait, I should probably share my screen first. Hang on, don't go anywhere. Stay right there. Hang on. Alrighty, application, share. Okay. Yeah, it looks like a lot of people are on vacation, so sorry, it's just kind of very intimate, but that's all right. All right, so ACEs trauma in the brain. And this is, you don't need that. Sorry, this is, wow, that's too much. Okay, sorry. Yeah, I'll spend a few minutes talking about me. No, let's not, I'm kidding. Okay. Yep. So again, some of the things to kind of bring up about, when we're talking about adverse childhood experiences, we're talking about chronic toxic stress. And obviously our focus here is mental health, right? So important to remember, exposure to chronic and complex trauma, it actually attacks one's core of selfhood and sense of agency. And we'll talk a little bit more about that in a few minutes. This is actually really interesting. I'm also talking about this with a group that's involved in advocating against human trafficking. And it's you can imagine the vulnerability of folks who have been exposed to adverse childhood experiences to future victimization. So a lot of folks who are victims of human trafficking actually have had exposure to adverse childhood experiences, and makes them more vulnerable to future victimization. So again, 3 forms of abuse. So again, this is how I remember and bundle these things to help me remember. So there are 3 forms of abuse. There's physical, emotional, and sexual abuse histories. There are 2 forms of neglect: physical neglect and emotional neglect. And then 5 forms of household challenges. There's parental separation, an incarcerated family member, mental illness in the family member, domestic violence directed at mom, and a family member with substance use disorders. So again, the way you kind of calculate this sort of risk score is 0 to 10, pretty straightforward. You try to understand how many of these someone has before age 18, and there's your score. Now this slide here, you'll see there are negative percentages here. I like this chart because it describes how much ACEs are responsible for several of these conditions. So for example, if we were to make ACEs go away, 44% of people with 44% of the people with depression would no longer have depression. COPD, 27%. It would be a 27% drop. So what this is telling you is how much ACEs play into what we see every day. So depression, COPD, asthma, kidney disease, stroke, coronary artery disease, cancer, diabetes, being overweight and obese. In terms of health risk behaviors, smoking, 33% of smokers would no longer be smoking if we magically made ACEs disappear. Heavy drinking, 24% of people who drink heavily would no longer drink heavily. And in fact, there's a really remarkable statistic, which the number is around 50 to 60%. And essentially what the number I'm describing is, if I took 100 people, if I took 100 people with an ACE score of at least 1 and having substance use disorders, and I made ACEs disappear, about 50 to 60% of people with substance use disorders in that group would no longer have substance use disorders. In other words, in people who have at least 1 ACE, 50 to 60% of them, of the folks with substance use disorders, have that because of the ACEs. So again, it's a little bit, forgive me if it's a little twisted, and we can talk about it a little bit more if I can, maybe I didn't clarify it as well as I could have. But the bottom line is, adverse childhood experiences account for a lot of morbidity and mortality we see in both physical and mental health in adulthood. And then similarly to socioeconomic challenges, it has impact on unemployment, on education, and access to health insurance. Now, what's critical to understand about kind of why ACEs is so important, has such an impact, right? So a couple of things. We're talking about not just one-time events. We're talking about exposure to chronic toxic stress. The other thing that makes this so problematic and impactful is that it's interpersonal trauma. And think about it. The people, right? So the adults who are raising these children, right? And this is all of us, right? So sometimes I make a mistake and I'm like, oh, those people. Well, this is all of us, right? This is all of us. So, right, we parents, we try as best as possible to keep our children safe, both physically and psychologically safe, have a predictable environment, and provide them with as much care and nurturing as possible, right? But nobody's perfect, and we are the ones, we adults, we parents are the ones who are supposed to be the most protective and the most safe for these children. What's difficult about interpersonal trauma is the people who are most expected to provide safety and nurturing are sometimes the ones who are actually causing the damage and the pain. So that the fact that the person closest to the children are causing some of these problems is what makes it so impactful, right? So now all of a sudden the children question, well, who is safe? If my parents aren't safe, who is safe? Right? And their ability to kind of trust themselves and their own decisions about people is called into question, right? So if you imagine a good enough experience, or maybe an optimal experience, is when a baby is born, baby cries and sends a signal to the parent. The parent then comes and comforts the baby and tries to understand why the baby's crying. Is it because the baby's hungry? The baby went to the bathroom or needs to go to the bathroom, and what happens is that the parent and the adult comes in and tries to regulate the child's emotions by soothing, by providing the food, right? So there's kind of this co-regulation that's happening where the baby is dysregulated, then causes some dysregulation in the adult. The adult then tries to calm the baby down and re-regulate the baby, which then leads to regulation in the adult, right? So it's co-regulation happening. In a situation where there's interpersonal trauma and the parent is not responsive to these signals, right? The baby sends a signal, but there's no response to the signal. And so the baby starts to learn early on that, hey, sending a signal to the environment doesn't lead to a response. And so now their perception of what life and the world is like is very different. And that's what leads to a lot of the dysregulation in the future. So what I would encourage you to think about is what interpersonal trauma does, and the exposure to ACEs. It really wreaks havoc on a person's ability to self-regulate, to regulate emotions, regulate behaviors, regulate attention. So the self-regulation piece is really broken. And you'll see in adults who've been exposed to lots of ACEs growing up, struggle for a long time with self-regulation, and then might resort to some maladaptive ways of self-regulating by cutting, using drugs, alcohol, some adaptive ways of self-regulating, and hopefully we all have some of those as well, is right. It could be going for a walk, exercising, dancing, playing music, listening to music, right? Those are ways to kind of self-regulate that are adaptive. So again, interpersonal trauma, the definition, talking about emotional abuse, emotional neglect, physical abuse, physical neglect, sexual abuse in childhood or adulthood. Interpersonal trauma has a potential to damage the following: an individual's understanding of him or herself, and interpersonal relationships. Again, remember back to the trust piece. And also the sense of agency, right? If somebody's sending a signal out into the community, into the world, into the family, and there's no response, they lose this sense of agency, in the sense that they can actually have an impact on the world around them. So one of the things you'll see here, I write diagnostic limitations. And the reason I write that is because exposure to chronic and complex trauma doesn't automatically mean, oh gosh, you had trauma, therefore you have PTSD. Unfortunately, the PTSD diagnosis in the DSM-5 is not as comprehensive as it could be, and there's been debate about a better definition or better layout of the criteria for traumatic for the impact of traumatic stress in childhood, but we're not there. And so what ends up happening is people develop all sorts of psychiatric problems. Not only can you have PTSD, sure. A lot of times the diagnosis I'll give someone who's been exposed and actually shows the symptoms, I'll give them diagnosis of chronic PTSD. But also a lot of kids have been exposed to trauma will show up and have potentially a diagnosis of ADHD because they're struggling with self-regulation. They struggle to regulate their own behaviors, their emotions, their attention. And again, that all happened in part because of the exposure to this chronic complex stress. So one of the things just to mention and kind of review quickly is what's the impact of stress. So in general, right, so it's a very simplified version of the pathway, but essentially we have our five senses. Our senses experience something that our amygdala, a small part of the brain, our amygdala then signals as danger. So the amygdala interprets information that comes in from the senses and interprets it as danger. The amygdala then sends a signal to the hypothalamus. That's in the brain still, right? So the amygdala, hypothalamus, and pituitary gland, they're all in the brain, okay? So amygdala sends a signal to hypothalamus. Hypothalamus then sends a signal to the pituitary gland. And then the pituitary gland sends a signal to the adrenal gland, which sits on top of the kidneys. And And so what happens is hypothalamus sends a hormone to pituitary gland, which then releases a hormone that goes to the adrenal gland. And then the adrenal gland then releases cortisol. And cortisol is this stress hormone that has an impact across the body. And so again, in an ideal situation, well, ideal, that's a silly way of saying it actually. In a situation where there's one stressful event, this pathway gets triggered once and then shuts down once the threat has disappeared. So think about it as, kind of like an emergency, it's like a fire alarm, right? So the fire alarm gets pulled, you take care of the fire and it's shut down. But if somebody's constantly pulling the fire alarm, now you're going to start causing problems. I'll add this. I want to make sure we covered this. Right, we talked about PTSD diagnosis being helpful in a context of a single traumatic event. We talked about growing understanding of chronic complex trauma and its effect on the body and mind, and that's kind of what we're talking about here with the cortisol. And then chronically high cortisol levels can have drastic effects on a person's health. And so what are these effects? Well, so if you're constantly activating this alarm system, that means you're constantly releasing cortisol that's living in your system more than it should be. And our body is not designed and our brain is not designed to keep being bathed in cortisol over time. And so the overexposure to this actually poses health risks, including anxiety and depression, digestive problems, because cortisol, what's remarkable about cortisol, it helps regulate a lot of functions in the body. And one of them is actually metabolism of fats, proteins, and carbohydrates. Headaches, muscle tension and pain. It actually leads to problematic chronic inflammatory and immune response, heart disease, heart attack, high blood pressure and stroke, sleep problems, messes with the circadian rhythm, weight gain, like I mentioned, messes with metabolism, and then memory and concentration impairment. So what do you do about all this? Let me see, good. So while it's fine to think about the risk factors, right? So think about, when you think about risk factors, always I want to encourage us to think about protective factors, because there are two sides to this coin. Everybody's born with risk factors. Everybody has some protective factors. And so again, if we focus only on the risk factors, right, that's a very one-sided view or picture of the person we're working with. So compare it to like an accounting of assets and liabilities, right? So the protective factors are your assets, right? That's the good stuff. And then liabilities are kind of the risk factors, the things that are potentially damaging or problematic. And so the important thing to keep in mind is even if you, right, and any of us, we all have risk. We all have, most of us have, right? 2/3 of us have an ace, and 1 in 8 of us have 4 or more aces. It doesn't mean we're doomed. It means those are our risk factors, and now it's important to kind of build up our protective factors, to build up the other side of the coin, the other side of the ledger, and that's what really good interventions do, and that is build up the protective factors that counter the stressors and the risk created by the aces. So what does recovery and treatment look like? Right. So again, victims of adverse childhood experiences, in some cases may have to relearn what some of us maybe who haven't been exposed to as many aces take for granted in terms of feelings of safety, psychological and physical safety. Again, what is safe, who is safe, what's internal, external to self. Again, if exposure to a lot of aces makes it difficult to really have a good feel for if there's a sense of agency and the ability to kind of act on things outside of oneself. What can be accepted, what can be refused from people. And then, certainly ongoing therapy, counseling, and medication management can be helpful. It's not curative, but ultimately, a trauma-informed approach, and then providing, because what's broken or what's disrupted in situations of chronic, complex, and trauma and high ACE scores is there's interpersonal trauma. So the only way to kind of fix or address that is by having interpersonal approach to building up protective factors. So again, if people are the ones that cause some of these ruptures, people are also the ones that are going to help with fixing that. So providing a safe, caring, loving environment obviously would go a long way. And obviously that includes psychological safety. So that's the presentation, and I'm I'm able to answer questions about this presentation or other issues surrounding trauma and ACEs. Questions, comments, criticisms?
So I have a question for you. This was brought up at a community meeting the other day. You know, you talk about a little bit about those protective forces and thinking about, you know, helping the next generation. Do things like parenting classes and that self-identification of ACEs actually help victims?
So, I was asked. I'm going to answer a question this way. I was asked by there's some folks. I think Yellowstone County, or no, it was City of Billings. Just I think they're generating some extra revenue from so marijuana just got legalized in Montana for recreational marijuana, and so it's generating extra tax dollars in a lot of communities. What's interesting to me is that some of these communities are setting some of this money aside for mental health, which kind of a little weird because marijuana actually leads to a lot of mental health problems. So I don't know how awesome that is, but anyway. I was asked to say, hey, look, if you had the choice of any investment to improve the long-term mental health outcomes in the community, what would you invest in? And so to your point, Amber, I would invest. Actually, there's a program called the Nurse Family Partnership, which is a home visiting program where I think moms, I don't know how much involved they get with dads, but hopefully they do. But they identify parents who have a history of ACEs and are at risk of exposing their children to ACEs. And nurses are trained to go into the home and work with these parents or parents to be. To your point, Amber, to do some parenting work about what works, what doesn't work in parenting, but also helping parents to start self-regulating in a way that's more adaptive and more healthy, right? So they won't fly off the handle, or they won't lose their temper, or they won't get aggressive physically or verbally. But also even just helping with resources, right? I mean, one of the things when I work with parents because a lot of the parents, and like you said, there's this cycle, right? It gets passed on intergenerationally, right? So if you have an adult who's been exposed to lots of ACEs, there's a higher likelihood that they'll expose their children to ACEs, and it's not anything willful other than that's just the world they know. So how do we break that cycle? And that's what I like about the Nurse Family Partnership. It kind of intervenes right at the interface between those two generations, right? So they intervene before the mom gives birth, and does some supporting and identifying kind of what are their psycho and social needs. So the other thing is, even sometimes I'll prescribe to parents, if possible, some respite. Just take a break, like get yourself reset. So anyway, that's a long-winded answer, but yes, intergenerational stuff is important to consider. Moving as far upstream as possible. Parenting support and parenting classes are important.
Awesome.
And you also mentioned kind of self-awareness of ACEs. I think as long as the self-awareness that's taught and the education around ACEs is done in a balanced way. Again, the danger of teaching a lot of people about ACEs is that you don't want to scare people and be like, oh my God, I have 3 ACEs. Does that mean I'm going to commit suicide next year? No, it doesn't. But people worry about that. Or does that mean I'm going to have a heart attack and become obese in 5 years? No, that doesn't mean that. It just, like, we all have risk factors, right? There's genetics and environment, right? Genes and environment. Those are basically the things that lead to us having disease or not. So again, and when you look at genes and environment, our genes and our environment confer risk and protection. And so just looking at both sides of that and understanding that we are talking about ACEs, that's just one side of the coin, but we also have to do an inventory of what's protective. What do you have that's actually helping you? Other questions or comments? I guess I'd be curious because my feeling is over the last 5 to 10 years, we've been talking more and more about ACEs. And what I think for a while there was the hope that, gosh, if I screen everybody for ACEs, then we can do something with that. Well, right, it's not so easy, because now just because you have an ACE score of 5, it gives me a much better understanding of your risk factors, but then let's also do a screening of protective factors, and some real education about what these numbers mean. But ultimately the intervention is, again, if we're talking about children, like you've heard me say before, the intervention always has to involve the family system. It can't be just, the child does not live in isolation. Child's always part of a family system, part of a school system. And so that's why, again, always being able to zoom in and out is important, where we're kind of assessing the mental health of, both youth and adults. You guys don't ask questions, I'm gonna keep talking, and it's gonna be painful. You guys are boring. Come on.
Anybody have any interesting cases that they would like to share?
Well, I'm gonna ask for some feedback. I'm gonna pick someone. I want to know how has your understanding of ACEs, I guess, evolved or even impacted your work. How about Assad?
You're on mute if you're trying to talk.
Hey, great job. Yeah, sorry, I thought this was going to be on autism according to the schedule.
Oh no, I'm sorry. Yeah, I'm sorry. I messed up, and ACEs was supposed to be next week. I messed up the schedule. I apologize.
Oh, that's all right. Yeah, so I'm a child psychiatrist and pediatrician, and yeah, I don't think ACEs are the big game changer in anything with child mental health so far. I mean, it was kind of intuitive to anybody who works in is that these experiences are important. The problem is always lack of access to adequate treatment. There's a big shortage of child therapists, child psychiatrists in Hawaii. So that's where the problem is, in my experience.
You're right. And Assad, I'm curious, when you were in getting your training, like residency and fellowship, did they teach you about ACEs? Because they didn't teach me about ACEs. I learned about it afterwards.
Yeah, the term ACE probably, like you said, became popular within the last 5-7 years or so. So during my training, that wasn't a term, but these are just things that we always screen for. And if the original screening people don't do it, we get it on initial history if the kids come in the clinic or in the hospital. So
yeah,
it was always things that we took into consideration. So yeah, to me, it seems like a buzzword. I think it's maybe to increase awareness for maybe the general pediatricians or family practitioners. But again, once you screen and identify, what do you do after that? You have to refer to treatment. And that's been the big bugaboo for all my career as a physician.
Yep. No, absolutely. Yeah, thanks, Assad, for being a good sport and jumping in. Thank you for that. I'd love to hear, and of course, any other thoughts? I mean, Heather, do you mind giving just a comment on what, if any, impact kind of the increased awareness of trauma has had on your work?
So I'm kind of like Assad. I was assuming it was going to be autism based today, but I stayed because this is also an interesting topic to me. I am actually a nurse at a critical access hospital, and so we have trauma receiving in an ER room, and I figured attending some of these would be helpful for me, either to educate myself as well as the other nurses on the floor. I have never had any formal training in anything in terms of ACEs or psychology. It's just always been kind of an interest of mine. It is pretty intuitive, I think. Certain things like traumatic events or trauma can, I guess, influence some of these issues that you brought up, like substance use and depression. It's in the back of my head it's kind of a given, but it was really interesting to see the risk scores and everything like you explained it today. And it'll be interesting to see how that develops in the future.
Yep. Well, thanks, Heather. Any other thoughts or comments around this? Cool. And again, in terms of treatment, and then if other people have comments about this, in terms of treatment there's no one medication, there's no one necessarily intervention, especially if you're not addressing the entire family system. So unfortunately, it's hard to, if you're looking at years of exposure of chronic toxic stress, having intermittent appointments with therapy and psychiatry is not as powerful as also having the families involved in creating a different environment, an environment that perhaps is more psychologically and physically safe, nurturing, predictable. Having again, as you hear me talk, think about we're building up protective factors. Having being at a school environment that is safe and has some loving and supportive teachers, other adults. You've heard this before, but this stuff is true and it makes a difference. That's the stuff that ultimately, by building up those protective factors, that starts to potentially undo some of the problematic exposure in early childhood. So yeah, so the next session we'll do autism. Again, I apologize and thank you for your patience. And sorry to those of you who are really looking forward to autism presentations. I got that next time. We'll be sending around the presentation if you'd like to use it. But otherwise, if there are more questions, I just thank you guys all for showing up in the summer. Everybody's, I know it's beautiful out, got other things they want to do, but appreciate you showing up today.
Awesome, thanks.
Thank you guys. Bye.
Bye.